One morning, I got up and got in my car like I do every day. My heart started pounding, I had trouble breathing, and I pulled over to the side of the road, and I really thought I was dying. I called 911, and I remember them putting me on the gurney and then loading me into the ambulance. And so they took me to the local emergency room. He ran a number of tests and came back and said, "What I can tell you is you didn't have a heart attack. Not really sure what is going on with you. You're fine and you can go home." I'm fortunate enough to live just a couple blocks from where my longtime primary care physician is. And I went into his office and we sat down and he just said to me, "Tom, I don't think there's anything wrong with your heart. What you've been experiencing are panic attacks." I was lucky. My doctor saw me as a whole person, and he was able to identify what was going on with me, that what I was facing were behavioral health challenges that required a different pathway to my recovery. I know a lot of people who aren't as lucky. A third of individuals who are receiving care from their primary care or specialty provider also have a behavioral health challenge. It's a third of our neighbors. It's a third of the students in our schools. It's in our everyday lives. It's friends, extended family, and we know that those challenges are not getting met. As an organization that's over 115 years old, how do we remove these barriers that have existed for so long? How do we make sure that our clients are the lucky ones?
Compass Health is the behavioral health care leader here in the Pacific Northwest. We provide a whole array of trained staff, over 750 employees, all working to treat the behavioral health conditions of the folks in our community. In partnership with first responders and other members of our community, we help create a safety net for the most vulnerable members of our society. Counseling, group therapy, family therapy for kids and their families, all the way up to more intensive programs, 24-hour outpatient programs where people can access their clinician any time of day if they're having a crisis or need assistance. So we're really trying to offer an array of services at a level of intensity to meet whatever the need is of the individual who is coming to us for care. We give people the tools and strategies they need to live full and productive lives.
Given this growing awareness that physical health and mental health are completely and inextricably linked, we understand that some of the individuals that we serve are going to have difficulty getting their physical health needs taken care of as well. How can we ensure that these individuals have the physical health needs met as well as their mental health needs? We don't any longer separate out mental health care, behavioral care, physical health care, substance use disorder care. It means that all care is together, is integrated, is collaborative, and that all of the providers of that care are focused on giving that particular individual what they need, when they need it, wherever they need it. We have better outcomes for the individuals that we serve at a lower cost, and needless to say, everybody's happier about it that way.
I can see, having been here for 30 years, that we're bookending a generation of the organization. At Compass Health, we're transforming the way in which we provide care for those that come to us in need. We're developing new partnerships and new practices within our organization to ensure that we treat the whole person. We want to make sure that the patients that we serve are the lucky ones.